Hello, my name is Dr. Julian De Silva. I'm a London-based facial, cosmetic and plastic surgeon, and today I'm going to talk to you about some of the anatomy of the neck and how that can change with aging. And so the neck is very important when looking at facial aging because it's one of the commonest things after changes in the eyelids that gives you a slightly more tired appearance. So what is actually changing in the neck? Well, often there can be some fullness in the neck, and that can be resulting from some fat that's collected on the neck. There can be a laxity in the skin, which results in loose skin, and there can be effects of gravity. The dropping down of volume from the cheeks results in jowls and softening of the jawline, and that can overall give a more tired appearance in the neck. Underneath the skin is a cushion of fat, and that is important in keeping all of the neck smooth and even, but too much fat just results in fullness and difficulty in seeing the jawline. And so liposuction can be very powerful in reshaping this fat and giving more definition in the neck. Beneath that is the muscle of the neck, which is called the platysma. The platysma is like a sheet that goes from your collarbone all the way up to your jawline. And the relevance of the platysma is, well, when you're young, it's like a tight elastic sheet, but it tends to get loose with time. And generally from your 30s to your 40s, you can start to see 1 or 2 bands in the neck, which is the platysma muscle. And ultimately, that gives a more tired appearance. Now, if it's very early, that can be treated with non-surgical means, such as a little Botox. But there is a point where really the only difference that's going to make to the platysma is doing a procedure to the platysma, which is essentially tightening it almost like a corset, and that can give more definition to the neck. Beneath that, there are important blood vessels that are important to know about in terms of like the neck surgery, the bone and the underlying chin. And in some patients who have a fuller neck, well, they can have a smaller chin and everything is concertinaed back into their neck. And so sometimes adding like a chin implant at the same time as neck surgery, well, that can really improve the profile of the neck by creating more of an angle between the jawline and the neck, which generally looks a lot more youthful and gives better facial balance. I hope this information has been useful for you. Thank you for watching.